The President, Association of Community Pharmacists of Nigeria, ACPN, Pharm Dr. Samuel O. Adekola, describes the administration of the former governor of Ondo State, Dr. Olusegun Mimiko, as the least in performance compared to other administrations. He made this statement in an exclusive interview with CEO Africa in Lagos, where he describes the former governor as non-communicative.
I don't think I've ever seen any leadership like that of Olusegun Mimiko, that you will write a letter. There is no person that will tell me that you wrote. There's no letter you will write the governor of Ondo State under Olusegun Mimiko that will receive reply. In fact, the information had that he does not read. Governor Mimiko do not read letters, do not read communications. And what that means is that he believes he has it all. That's simply. So it cannot be correct, because one way to have to take a feel of the feel of the people is when they write you letters, when they write you their feelings. But our then governor does not believe one critical thing that he failed at is communicating with the people.
According to the ACPN president, the former governor enjoyed several privileges, adding that no other governor has ever enjoyed such in the state.
The goodwill that Dr. Olusegun Mimiko enjoyed of the people of Ondo State was unparalleled and highly unprecedented. And I don't think the people, there can be any governor in that state that will ever enjoy such goodwill.
Speaking further, Pharm Dr. Adekola, who hails from Ondo State, mentions that he is a critical stakeholder in the leadership, governance, services and welfare of the people of Ondo State. And to this extent, he has been following the events, happenings, discussions and the trading of words in Ondo State. He mentions working closely with the state government under former Governor Olusegun Agagu and Dr. Olusegun Mimiko. Dr. Samuel ascribes the administration of former Governor Olusegun Agagu as progressive. He describes him as a man of service who had the people of Ondo State at heart.
I have been in leadership in Ondo State by the grace of God since 2006 effectively. And this was under Olusegun Agagu. I spent some few years with Olusegun Agagu. I was the chairman of a group of pharmacy they called industrial pharmacies in Ondo State then. By 2008 and by 2007, I became a vice chairman of the Pharmaceutical Society of Nigeria in Ondo State. And after 3 years, by 2009, February, incidentally, the same month, Olusegun Mimiko came into office. I became the state chairman of the Pharmaceutical Society of Nigeria in Ondo State. And I was privileged to serve the people, even as a young, probably one of the youngest among them. I think I was 34 then. And I was privileged to be given the opportunity to serve them as their chairman, and the privilege was such that against the constitution of the Pharmaceutical of Nigeria, I was given opportunity to serve 2 cycles of terms, which means a total number of 6 years. By constitution, you are entitled to serve maximum of 3 years. But my experience, my service experience there, gave me the opportunity to be allowed to serve the state for another set of 3 years. So altogether, I served under Governor Olusegun Mimiko for 6 years. Don't forget, I had about 2 years under Dr. Olusegun Agagu, our late governor. And now, after this, for about 2 years now, I've also been serving, though no more as in the state, not serving in the state, but I equally, because I'm serving nationally now, as national chairman of the Association of Community Pharmacists, I have my members, I have the Pharmaceutical Society of Nigeria in the state, so I have opportunity to also get back to the state and follow the event in the state. So I am going to be talking, sincerely yours, expressing my view and what I know from the day of Agagu through Olusegun Mimiko, and for the little time I've come to know the current governor of the state. Sincerely yours, I cannot but give it to Dr. Olusegun Agagu. Agagu was a man, a governor that you will write a letter and that will reply you. And what that means is that there is a connection, there is a communication. I mean, when you write a letter, you sit down to write a letter to the government, to an individual, you deserves a answer. That Olusegun Agagu did excellently well.
On the economy of the state, the ACPN president condemns the statement of Dr. Olusegun Mimiko, which he made recently, that Governor Akeredolu is not progressive, implying that he has not continued the programs he left behind. However, Pharm Adekola emphasizes that Governor Rotimi Akeredolu's son cannot adhere to them because they were failed projects. He reiterates that the policy of categorization in the health sector, which Dr. Mimiko introduced, was a failed project. Some of these failed projects include the non-payment of workers in the state, the non-transparent ABA project, Mother and Child project, which he referred to as the former governor's strategy of robbing the private sector to pay the public sector, an agenda Dr. Mimiko used to boost his image in the eyes of the people.
I will also want to say about the administration of Olusegun Mimiko, particularly as regard to what one of the comments I read in the social media, to the effect that Olusegun Mimiko called the current governor of Ondo State not a progressive, that he did not continue, some of his projects. I felt very, very sad to hear that. And I want to ask, I wish I could see Dr. Olusegun Mimiko to ask him questions. When you say that I don't know which project you talk about. Is it the project of not paying salaries of workers? When you were leaving office, you have about 8 months salary, deficit, inherited by new government. Is that the kind of progressiveness you want a new government to do? And I read after another few weeks that he said he left 20 billion in office. Then the question that came to my mind was, okay, that 20 billion, assuming 20 billion was indeed left in the coffers of the state government, was that 20 billion enough to pay the 8 month salary? So if it is, why don't you pay the people? Why should you allow people to work and not pay them? And now you say you left. Why do you leave it there? For what? But if you want to compare what Olusegun Mimiko met in office and what he said he left, comfortably, even as not a non-government person, Olusegun Mimiko met over 76 billion naira in the coffers of Ondo State government when he came in. The records are there. His uncle are the people who were there. One of them was made the CMD of the Mother and Child that I was talking about. He was the CMD of Mother and Child in Akure. After crumble Mother and Child in Akure, Ondo State, another Mother and Child that came up in Ondo, it was made the CMD. And the same thing, both hospitals became debt ridden. Is that the kind of legacy you want another government to continue? I tell you today, many pharmacists lost their job because they were serving Ondo State. Medical representative lost their job because they said to the government, they said to God, they said to Mother and Child, they said to hospital in Ondo State. At different times, they don't protest. They carry placards. But we continue to press and let's see how we can. By February this year, when we went to Ondo State, it was one of the demands we made to the governor to see how he can help us pay some of this debt of Dr. Olusegun Mimiko. So, is that the kind of policy you want to continue? You are robbing private sector to pay and tell people you are giving them free head, you are giving them free drug. Is that a legacy that should be continued so that people continue to be killed? And now people have stopped. At a point, people stop supplying. So, I feel a little bit disturbed.
He also states that Dr. Mimiko, being a brilliant politician, was not a good governor. He believes that the goodwill he enjoyed would have positioned him as Tinubu of Ondo State. but he did not maximize it while he was governor. He commends Governor Rotimi Akeredolu-San as a performing governor for Ondo State with reference to achievement and responsibility to the people of the state, adding that Governor Akeredolu is not as good as Dr. Mimiko in terms of politics, but good in governance.
But after about 1 year in office, I expressed my displeasure to him to say we didn't know you are worse than your predecessor in office. Because this is not what we expect from you. These are the kind of leadership we expect from you. Unfortunately, why this one is paining me is the fact that today, Dr. Olusegun Mimiko would have probably be a potential president of Nigeria. If not, the least Dr. Olusegun Mimiko would have been is a vice president of Nigeria. But look at him, he was the one that contested for Senate. Ordinarily, he could not get it. So where is that goodwill that people had for him? Dr. Olusegun Mimiko is somebody who has gotten you serve twice as commissioner, you serve as an SSG, you serve as a minister. What else? And you now serve 8 years as governor, and yet you left the governors. You could not win a senatorial district, and you think it's a good thing, it's a good omen. No, but that's not good. It touches on it. For example, today, if Dr. Mimiko is the president of Nigeria, a number of us in those states will be jumping up because we say, "Oh, our man is the president." People from Katsina today, so many of them have opportunity to work to be in federal government. If he's a vice president, the same thing would have happened. But because I can say to you, Dr. Olusegun Mimiko was a brilliant politician, but he was never a good governor. He was never. And I beg to say it any day, anywhere. I stand corrected. He didn't rule well, because one other thing we also expected from him was the fact he would have successfully, with that kind of goodwill, with that kind of power, with that kind of support he enjoyed from the people, Olusegun Mimiko today will have been another Tinubu of Ondo State in the southwest, but he's not.